Hello everyone, welcome back to our internal medicine series. I'm Dr. Hivi and today we are talking about hypothyroidism in dogs and cats. We will break it down step by step using a real case so you can connect clinical signs, diagnosis and treatment like a veterinarian. First of all, what's hypothyroidism? Hypothyroidism is a deficiency of thyroid hormones, mainly T4 and T3, which are responsible for regulating metabolism. So when these hormones decrease, everything slows down. Metabolism, skin turnover, hair growth, and even cardiovascular function. In most dogs, hypothyroidism is primary, meaning the thyroid gland itself is failing. The most common causes are lymphocytic thyroiditis, thyroid atrophy, and this leads to low T4 and high TSH due to loss of negative feedback. So the body is basically trying to push the thyroid, but it's not responding. So now instead of memorizing, let's connect. A 2-year-old spayed female Labrador presents with weight gain, lethargy, normal appetite, bilateral non-pruritic flank alopecia, and poor coat quality. On physical examination, the dog was overweight, had pale mucous membrane, and showed skin scaling with no lesions or itching. So now let's think like a clinician. What are the problems here? First, weight gain. Second, lethargy. Non-pruritic symmetrical alopecia, pale mucous membrane, and finally skin scaling. This step is critical. Without a problem list, you are just guessing. The most important step is differential diagnosis. For example, for weight gain, the most common cause is overfeeding or drugs like steroids, endocrine disease like hypothyroidism or Cushing's disease. And for bilateral non-pruritic alopecia, you have to focus on non-inflammatory causes like hypothyroidism, Cushing's disease, alopecia, or hypogonadism. Now let's narrow it down. No itching rules out many skin diseases. No polyuria, polydipsia makes Cushing less likely. Normal appetite and weight gain are classic signs for hypothyroidism. Symmetrical alopecia, for sure it's an endocrine pattern. At this point, hypothyroidism becomes highly suspicious. But before confirming hypothyroidism, we always start with routine lab tests, including hematology, serum biochemistry, and skin evaluation. On hematology, one common finding is a mild non-regenerative anemia. In serum biochemistry, we often see hyperlipidemia, especially increased cholesterol and triglycerides. This happens due to decreased metabolic rate and impaired lipid metabolism. Now, when it comes to dermatological findings, these are actually very characteristic. We often see bilateral symmetrical alopecia, dry dull coat, hyperpigmentation, and sometimes recurrent skin infections. These skin changes occur because thyroid hormones play a major role in hair growth and skin turnover. So even before hormonal testing, these findings can strongly point us toward hypothyroidism. Now let's talk about diagnosis, because this is where many cases get tricky. First, we always start with clinical suspicion based on history and physical examination. Then we move to lab testing. The most commonly used screening test is total T4. If it's low, it raises suspicion, but it's not definitive. Why it is not definitive? Because other conditions can suppress T4 levels, a phenomenon known as euthyroid syndrome. So to confirm the diagnosis, we rely on more specific tests. Free T4, which is more accurate, and TSH levels, which are usually elevated in true hypothyroidism. So the combination of low T4 and high TSH strongly supports the diagnosis. The diagnosis is not based on one test. It's about correlating clinical signs with lab results. Treatment of hypothyroidism is straightforward and very rewarding. The drug of choice is levothyroxine, given orally. Most dogs show clinical improvement within a few weeks, especially in activity level and skin condition. And monitoring is essential. We recheck T4 levels after starting the treatment to adjust the dose if needed. The treatment is usually lifelong, and with proper management, the prognosis is excellent. And that's it for today. If you made it this far, make sure to like and subscribe, and I'll see you next week with another case. Stay safe.